normally has 32 permanent teeth. Gauge is the inside diameter of a needle. The smaller the gauge, the larger the diameter. Laws regarding patient self-determination vary from state to state. Therefore, the nurse must be familiar with the laws of the state in which she. After bladder irrigation, the nurse should document the amount, color, and clarity of the urine in the presence of clots or sediment. After bladder irrigation, the nurse should document the amount, color, and clarity of the urine in the presence of clots or sediment. On a drug prescription, the abbreviation P. Circa means that the drug should be administered after meals. After suctioning a tracheostomy tube, the nurse must document the color, amount, consistency, and odor of secretions. Axillary temperature is usually 1 degree Fahrenheit lower than oral temperature. A thready pulse is very fine and scarcely perceptible. The nurse should use a warm saline solution to clean an artificial eye. To remove a patient's artificial eye, the nurse depresses the lower lid. OU means each eye. OD is the right eye, and OS is the left eye. Brutes commonly indicate life or limb-threatening vascular disease. During the evaluation step of the nursing process, the nurse assesses the patient's response to therapy. Gastric lavage is flushing of the stomach and removal of ingested substances through a nasogastric tube. It's used to treat poisoning or drug overdose. A foot cradle keeps bed linen off the patient's feet to prevent skin irritation and breakdown, especially in a patient who has peripheral vascular disease or neuropathy. Ballottement is a form of light palpation involving gentle, repetitive bouncing of tissues against the hand and feeling their rebound. During percussion, the nurse uses quick, sharp tapping of the fingers or hands against body surfaces to produce sounds. This procedure is done to determine the size, shape, position, and density of underlying organs and tissues, elicit tenderness, or assess reflexes. A patient must sign a separate informed consent form for each procedure. Before signing an informed consent form, the patient should know whether other treatment options are available and should understand what will occur during the preoperative, intraoperative, and postoperative phases, the risks involved, and the possible complications. The patient should also have a general idea of the time required from surgery to recovery. In addition, he should have an opportunity to ask questions. The measurement systems most commonly used in clinical practice are the metric system, apothecary's system, and household system. Laboratory test results are an objective form of assessment data. In a resting adult, the normal pulse rate is 60 to 100 beats per minute. The rate is slightly faster in women than in men and much faster in children than in adults. The most accessible and commonly used artery for measuring a patient's pulse rate is the radial artery. To take the pulse rate, the artery is compressed against the radius. Factors that affect body temperature include time of day, age, physical activity, phase of menstrual cycle, and pregnancy. When documenting patient care, the nurse should write legibly, use only standard abbreviations, and sign each entry. The nurse should never destroy or attempt to obliterate documentation or leave vacant lines. The physical examination includes objective data obtained by inspection, palpation, percussion, and auscultation. The patient's health history consists primarily of subjective data, information that's supplied by the patient. During the assessment phase of the nursing process, the nurse collects and analyzes 3 types of data: health history, physical examination, and laboratory and diagnostic test data. A nursing diagnosis is a statement of a patient's actual or potential health problem that can be resolved, diminished, or otherwise changed by nursing interventions. Bradycardia is a heart rate of fewer than 60 beats per minute. Collaboration is joint communication and decision-making between nurses and physicians. It's designed to meet patients' needs by integrating the care regimens of both professions into one comprehensive approach. Iron-rich foods, such as organ meats, nuts, legumes, dried fruit, green leafy vegetables, eggs, and whole grains, commonly have a low water content. The best dietary sources of vitamin B6 are liver, kidney, pork, soybeans, corn, and whole grain cereal. Nurses are commonly held liable for failing to keep an accurate count of sponges and other devices during surgery. A primary disability is caused by a pathologic process. A secondary disability is caused by inactivity. The optic disc is yellowish-pink and circular, with a distinct border. Percussion causes 5 basic notes. Tympany, loud intensity, as heard over a gastric air bubble or puffed-out cheek; hyperresonance, very loud, as heard over an emphysematous lung; resonance, loud, as heard over a normal lung, dullness medium intensity, as heard over the liver or other solid organ, and flatness soft, as heard over the thigh. A correctly written patient goal expresses the desired patient behavior, criteria for measurement, time frame for achievement, and conditions under which the behavior will occur. It's developed in collaboration with the patient. The autonomic nervous system controls the smooth muscles.